What's up, everyone, and welcome back to another episode of Health Yes, here at Cameron County Public Health, where we talk about all things public health and more. I'm your host, Javier C, and today we're here to talk about measles. Joining us today is Miss Stephanie Martinez, an epidemiologist here with us with our public health preparedness program. Welcome to the show.
Hi, Javi. Thanks for having me here today. So yes, I'm an epidemiologist. I'm part of the public health preparedness program. And yeah, like you said, we're here to talk about measles. What do you want to know?
So tell us a little bit about measles, what's currently happening here in Texas and, maybe here in the RGV. Have we had any cases of measles? What's going on here in Texas?
Yeah, so it all started in the South Plains region up north towards the Lubbock area. So measles is very highly contagious. It's a respiratory virus. It can cause high fevers, and it's well known for its rash all over the body.
Though we have not had a case here in the RGV, what are some things that we need to look out for, and what are some of the duties that you yourself as an epidemiologist do to help prevent the spread of measles?
I think one of the major things that everybody needs to look out for is being up to date on your vaccines. The MMR, measles, mumps, rubella vaccine is going to give you the most protection. It's 97% effective if you have both doses. So even if you were to come in contact with somebody that has measles and you're fully up to date on that vaccine, the chances of you getting sick are very low as opposed to you having one or no vaccine. But Javi, we haven't seen anything down here in Cameron County, but people should still be, remain aware of the situation, what's going on. Right.
So although you say that there hasn't been a confirmed case in Cameron County yet, we've got spring break coming up around the corner. What are some things that we should be looking out for?
Well, Javi, always keep in mind that diseases travel. So if people from up north are coming down here to South Texas, to SPI, to enjoy their spring break, you never know. Somebody might come down with measles and spread it around here. So it's always important to keep in mind, be aware of the situation, what's going on, and keep your vaccinations up to date.
Alrighty. What are some things that you yourself and our crew of epidemiologists do to handle this outbreak? What type of materials do we have available? What resources do we have for people to become aware?
So some things that we worked on, we've created an infographic, Spreading Awareness, Not Measles, which we've posted on our social media accounts, and we've sent out to schools as well, just to keep parents and teachers informed of what to look for, signs and symptoms of measles, the stages of the symptoms that measles come in, the fever, the upper respiratory symptoms, the rash, and of course, what to do if your child does have those symptoms. Some other things that we worked on, we're of course staying vigilant, watching the laboratory results that come in, talking with providers if they feel like they need to test a certain patient because they meet the certain criteria of the symptoms. So we also created a school packet that we sent out to schools, and that has all the information, of course, of what should the school nurse do should a student appear in class that has the symptoms that are related to measles, how to disinfect the classrooms, and of course, most importantly, when to exclude students from school if they come into contact with somebody with measles. We also created a provider packet, and that one pretty much informs providers, healthcare professionals on what to do and when to test patients that go into their office for measles. So of course, we always leave it open to them to call us if they need further guidance on whether a patient meets criteria, or also where to send any laboratory results to get tested.
Gotcha. Now we've talked about providers and we talked about the school response plan. What would you say is the most common age group that has measles currently?
School-age children are the ones that are most at risk for contracting measles, especially because, the child goes to school, you send them off to school, your child might be up to date on vaccines or might have one vaccine, and there might be children that are around them that are not vaccinated, and they're the ones that are more susceptible to getting ill. And once they have that illness, of course, it's highly contagious, so it easily spreads among the classroom, particularly in the population that is not vaccinated.
Mm-hmm. All right. So in hearing about the recent measles outbreaks, what are some concerns that people have had regarding measles?
Yeah, so we have had some calls, but they're mostly about the MMR vaccine. And we always tell people to contact their primary care provider to get more information on that vaccine.
Awesome. What are some prevention tips and key points that people should know?
The biggest prevention tip that I can give is being up to date on the MMR vaccine. The vaccine is what's going to protect you the most when you come into contact with anybody with the measles virus. Some key points that I want people to know is to treat this disease as you would any other disease. Again, this is a respiratory virus, so please keep in mind hand hygiene. Always teach your kids to wash their hands with soap and water. Always remind them not to share any of their drinks or anything really at school with other children because, again, like I previously mentioned, you know where your child has been, but you don't know where the other children around your child has been. So you never know who has been exposed to the measles virus.
Yep, exactly. Preventing the spread is key. We got to make sure people are not sharing things. Kids are not sharing things. We got to make sure those germs stay where they need to be. What are some final thoughts here that you want to share with our audience?
You know, Javi, out of everything that's going on right now with the measles, some people are panicking about it. But if there's one key thing that I want to say before I end here is that if Cameron County were to have a confirmed case of measles, you're going to hear it first from us, not from somebody else down the street, not from your neighbor or anything, but from here, from Cameron County Public Health.
All righty. Well, thank you so much, Stephanie, for joining us on today's podcast.
Well, thank you very much for inviting me.
Alrighty. And thank you so much to all of our listeners out there. Don't forget to follow us on Facebook, like us on Instagram, subscribe to our YouTube channel. Make sure you've got those notifications on, and follow us also on Spotify to never miss another episode. And remember, stay safe, stay healthy, stay educated, and stay informed. And we'll see you on the next one.